Hello, guys. Welcome to Hatsput Economics. Hatsput, you know what to do already. If you haven't done so, please like and subscribe to my page. And don't forget to tap that notification bell to get future notifications of all my videos. So welcome, guys. I want to get right down to it. I did a couple of videos on health. And the reason I did that, it is a massive economic drag on a already economically challenged community, the African American community. So, ladies, I want to talk about this with you because, my page is for you guys and I want you to know the facts. So I did a couple of videos with my face so you guys can remember who I am. But I do want to get back to my fact style YouTube reporting because that's what I like to do. I like to show you guys the facts. I want to make sure you know when I say things, I am not guessing. I am all about the receipts. So there's a lot of misconceptions in regards to why Black women have the healthcare issues that they do. People were saying things to me in my messages about obesity, about poverty. It has nothing to do with that. It is clearly an issue of inequality in healthcare, which is killing African Americans. And the reason why I say it has nothing to do with those things I just said prior is because even when Caucasian women and non-African American women have the same afflictions, they do not die the same way. So this is all about health care inequality, something that is not popular in name, but it is popular in action, which means that it is happening all over the United States. Because of healthcare inequality, I said this before in my PCOS video, United States of America is the number one G7 out of all the G7 nations for having women dying in childbirth, during child labor. And the reason is because of African American women. So that one metric of African American women dying has catapulted the United States to having the most significant women dying in child labor. So I'm just going to review this with you guys really quickly just to support the other videos I did. And it's called Inequality in Healthcare is Killing African Americans. So this is the Human Rights publication. And the person who did the article is Vernelia R. Randall, and she's a professor at the School of Law at the University of Dayton. All right, so she writes extensively and speaks internationally about race, women, and healthcare. So she's a recipient of Ohio Commission on Minority Health Chairman's Award, and she was named one of the top 10 most influential African Americans on the 2001 Black Equal Opportunity Journalists. As you guys know, I like to give you the receipts. So again, Black healthcare inequalities are the cumulative result of both past and current discrimination throughout U.S. culture. So I was going to pause right there. This is why it is important to talk about race. This country has a history of racial challenges, and the only way to overcome them and move forward and find solutions is to actually discuss it. You can't solve something if you don't discuss it. So due to discrimination, limited educational opportunities, Blacks disproportionately work in low pay, health risk occupations. They are migrant farm workers, fast food workers, garment industry workers. Historic and present racism in land and planning policy also plays a critical role in minority health status. So I just want to rewind there. Do you guys understand when they say historic and present racism in land and planning policy? So pause. One of the biggest reasons why racism in America is so challenging is because we have something called legal segregation. All right, that's just a term that I saw and I loved it. So legal segregation means you have entire mass cities in the United States completely segregated. So when you segregate people, whether it's legally or illegally, it makes it much easier to disproportionately attack vulnerable demographics. So let's just say you have 500 Black people, they're all concentrated in one area. It's much more easier for them to be a victim of poor education, healthcare inequality, or poor crime statistics, stuff like that, because you have them all in one area. You'll see throughout G7 nations that do have minorities, the more you have them actually integrated, which means more diverse neighborhoods, the less of these situations that happen. But United States is the number one segregated superpower in the world, meaning that it has, out of every G7 that has a large number of minorities, we are the most segregated, meaning that Some place like Manhattan that has over 100 nationalities has very segregated neighborhoods, meaning neighborhoods that have 80% or more of one specific ethnicity or culture. All right, so I hope that makes sense. For example, over-concentration of alcohol and tobacco outlets and the legal and illegal dumping of pollutants pose serious health risks to minorities. Going to pause right there. A lot of minorities have a higher risk of infertility, endometriosis, PCOS, which has been scientifically attributed to things in the environment. But because they're, minority neighborhoods, they don't really have that, red flag when they dump stuff. And this happens all over. So it's really important to know it's a socioeconomic factor that when you don't have that status in terms of economics and finance, and you don't have financial power, it actually contributes to lower health performance. That's why we're reviewing this on Hatsput Economics, okay? Exposure to these risks is not a matter of individual control or even individual choice. Health status disparities are a direct result of policies, practices, procedures, and laws, institutional discrimination that protect white privilege at the expense of Black health. Black Americans are sicker than white Americans, and they're dying at a significantly higher rate. These are undisputed facts. Black men live on average 6 years less than white men. Black men have shorter lifespans than men in Chile, Barbados, Bahamas, or Jamaica. Let's say that one more time. We like to clown these countries. Sometimes I do too, but black men have shorter lifespans than men in Chile, Barbados, Bahamas, or Jamaica. That's crazy. When you think about our GDP in contrast, that's a drop in the bucket. So when you see life expectancy in America, that's white life expectancy. That's not Black. Remember, there's only 45 million Black people in America. The majority of this country, over 60%, is Caucasian. All right? Black women have shorter lifespans than women in Barbados, Panama, Bosnia? What the hell? Bosnia and the Bahamas. I'm going to say one more time. Black women have shorter lifespans than women in Barbados, Panama, Bosnia, and the Bahamas. Infirmortality rates are 2 times higher for Blacks. Some racists have commented that African Americans should be grateful for being in the United States. Yet Black Americans have more low birth rate infants than women in Rwanda, Ghana, and Uganda. Let's say it one more time. Okay, this is extremely important. I say it a lot, but you know what? I only do important stuff on #But. Guys, this channel, I want this channel to circulate. I need you guys to get this information out there. Get proactive. Talk to your politicians. Talk to your senators. I'm all about solutions. This is not a channel about complaining. I'm all about the solutions, the receipts, and showing you. This is crazy. This is crazy. Social detriments of health are the primary factors in health status inequality between Blacks and whites. Social detriments of health are social, economic, political, and legal forces under which people live. These detriments include wealth, income, education, criminal justice, physical environment, healthcare, housing, employment, stress, and racism and discrimination. In fact, for Blacks, racism is a primary factor. Even when you control for economics, Blacks have poorer health. Let me say it again. Mercy. I'm going to underline this. Okay? One more time. In fact, for Blacks, racism is a primary factor. Even when you control for economics, Blacks have poorer health. So that's myself in there. Okay? Ivy League graduate, Cornell graduate. I don't want to say my salary, but yes, of course, I'm making over 6 figures. Real estate agent, medical sales device, event planner, HR director. I got misdiagnosed for endometriosis. I had to fight for my diagnosis for PCOS. I went to the top hospitals in the country, Presbyterian, Cornell, and Columbia, and I still was treated like a second-class citizen. It breaks my heart. I can only think about the Black woman who doesn't have a PPO, United Healthcare, who doesn't have a PPO, Blue Cross, like I did. This is real stuff. Black people, are you listening to me? All the fighting that we're doing, all the nonsense we're doing, this is real. This is why I have this page. This is why I'm talking about it. Economics touches everything essential for us to function. And I want to change the way we look at money, look at finance. It is everything in our life in the right way. All right? That is middle class blacks. Listen to this, suffer poorer health than middle class whites. In fact, middle class whites live 10 years longer than middle class blacks, while poor whites live only 3 years longer than poor blacks. Okay? Furthermore, the stress of living in a discriminatory society accounts for racial disparities. I'm just going to pause right there. We are so obsessed with how we are perceived by non-minorities. I would say non-minorities. We're so obsessed. We never stop to think about the social and the economic and the emotional stress about living in a society that's constantly discriminatory. I can't even say for myself, how does it feel to live in a society where you're literally a second class citizen? I don't know if you guys ever saw the thing called doll test. And if you don't, I'm going to include it in the description box, a link. And basically, doll test shows a series of children, all nationalities, picking up either a white doll or a black doll when they give something, a word association. Which doll is ugly? Which doll is smart? Which doll is... And these kids were super young. We're talking about 5, 6, 7 years old. And these kids were so young. And what happened is that all the black kids pulled for the black doll for all the negative connotations. Already at the age of 5, 6, and 7, these kids were already able to contribute negative aspects with these dolls. So they're already at a young age, they're associating these dolls with bad things. So it's really bad that we don't really study the effects of racism on black people. We seem to be a little bit obsessed about how we're perceived and not obsessed, but because that's important too, because, that's where discrimination comes from. That's where discrimination comes from. We don't really look to see what's happening to African American children. And it's sad because nobody teaches their child to hate themselves. It's crazy. It's crazy. So I'm just going to continue. Appropriate state and federal laws must be available to eliminate discriminatory practices in healthcare. And that's what I'm saying. I think the laws are on the book are actually antiquated. The laws are on the book are antiquated. You're talking about laws that are there for a long time. So compounding the racial discrimination experience generally is the institutional discrimination in healthcare affecting access to healthcare and quality of healthcare received. Racial discrimination in healthcare delivery, financing, and research continues to exist. Racial barriers to quality healthcare manifest themselves in many ways. All right. So economic discrimination, which rations healthcare on the ability to pay. Okay. So if you don't have good status of economic and money, you're going to get even worse and worse, which makes no sense. But you see how I did not get adequate healthcare for this to my PCOS video? You will get even worse. You probably won't even get a chance to get that level of worse. Racial discrimination in treatments and services, and culturally incompetent care. So let's review it one more time. Economic discrimination, which rations healthcare on ability to pay. Insufficient hospitals and healthcare institutions and clinics. Insufficient physicians and providers. I just want to talk about the insufficient physicians and providers. Black women, you have the right to a certified, board certified doctor. Okay, I was helping someone look for doctors, and she has Medicaid because I told you I do this counseling. I'm on Patreon. You guys can contact me, and we can talk about my counseling services. And I told her you need to make sure these doctors are certified. She was shocked to see that doctors in Black neighborhoods were not certified gynecologists. They were not certified obstetricians. They were not certified, gastrologists. That means something. Any doctor worth their grain of salt will definitely get a certification. No real hospital will keep you there except for public hospitals, which are a wasteland. Wasteland. Okay, so a healthcare anti-discrimination act. That is what we're calling for. I am supporting this. Black women, if you hear this video, if you're a friend of Black women, if you're a friend of Black people, okay, what we want to do is have a health care anti-discrimination act, which would, one, recognize multiple forms of discrimination. 2, authorize and fund testers. 3, assure appropriate fines or regulatory enforcement. 4, require racial ethnic disaggregate data collection and reporting. 5, provide a private and organizational right of action. 6, cover prevailing party attorney fees. 7, provide punitive damage in part or whole to fund monitoring and assessment programs. 8, require a health scorecard report card for agency provider or facility. Require a health scorecard report for health agency provider or facility. Unless specifically addressed, inequality healthcare will certainly remain and blacks will continue to die at disproportionate rates. So down here are all the, all the facts, all the receipts. You have a link down here for race, healthcare, and the law. Unnatural causes, unequal treatment, confronting racial and ethnic disparities in healthcare, and 2007 National Healthcare Quality and Disparity Reports. Again, guys, when I give you these reports, they are 100% factual, and I mean for them to, really get us engaged in finding solutions. So next time you're voting, this should be your platform, one of your many platforms. Next time you're out there, make sure you are doing what you have to do, saying what you have to say, and going to the stars and back, okay? So that's it. So guys, again, you can find me on Patreon. I do my HR consulting services. I do PCOS consulting services. And I do a lot of consulting services for human resources and career. So contact me if you have any questions, concerns, and leave your comments in the video. Thank you for watching Hasesput. Have a great night.